All right. First of all, before I'm going to start, I'm just going to say there's a mistake in the name. There's one name missing, Professor Yuval Bloch, which done so much for this study, and I really appreciate it. And your name should be here, and it's a mistake. Thank you so much. My name is Ron. I'm a child and adolescent psychiatrist resident in Shiba Medical Center. I'm going to present an interesting work we're conducting in Shiba and in Shalvata together. Well, as a child psychiatrist, I meet a lot of autistic individuals, children and adolescents, sometimes even adults. And I hear the word autism a lot, mainly as a diagnosis, but also as an identity and as a label. It made me think for myself, what does autism really mean? What do we actually know about it? Because if I'm going to ask each one of you, I bet the answer is going to be very different. As Professor Miri suggested when I talk about treatment to start with a question, so I'm going to start with a question. What do we actually know about autism? Well, it depends who you ask. Ask a child psychiatrist, he might see it through clinical lenses, symptoms, diagnosis, treatments, it's a neurodevelopmental disorders, DSM language. The parents to autistic adolescents might see the struggle. They see the school system. They think about the future, what the future holds. And the autistic adolescent might just say, it's a stupid label, or it's just how I am. So in this study, we asked these three different groups for their perspectives about autism treatments, and about neurodiversity. In order to really understand autism and gain meaningful insight, we didn't solely rely on child psychiatrists analyzing perspectives from the outside. We incorporated its collaboration between autistic and non-autistic researchers working together in each part of the process. From the recruitment, calling the families on the phone, asking them to participate, the interviews, 50% of which were done by autistic researchers, transcription, coding, thematic analysis, interpretation, and hopefully in the future also writing of the scientific paper. So what we're doing, we're conducting in-depth interviews with 12 autistic adolescents, 12 parents, and 12 psychiatrists, asking them the questions about autism, neurodiversity, diagnosis, treatments, and life with autism. From a preliminary analysis of 50% of the interviews from each group, we have identified four main themes. The speaker perception of autism, the impact of autism on the adolescent and the parent's life, perceptions about neurodiversity, and autism treatments, goal, challenges, and perspectives. Today, I'm going to present only the autism treatment goals, challenges, and perspective themes and the sub-themes inside. Okay, so four core aspects or sub-themes have identified. Social integration, reducing loneliness, independence and daily functioning, self-understanding and acceptance, and my personal favorite, masking. So I'm going to go through one by one. So across all three groups, social integration and reducing loneliness was a major goal, but the perspective differed in how to achieve it. We see that psychiatrists see social integration as crucial, but they acknowledge that autistic individuals may define connection differently. Parents, on the other hand, they emphasize the struggle. They see how their child struggle with making friends. They seek specific treatment. How can my child make more friends? They don't think about the rest. They just want him to have more friends, for example. We see the quotes from a psychiatrist: loneliness is not a core symptom of autism, but it may be a consequence of their differences. And a quote from parents: loneliness is one of the biggest challenges for children with autism spectrum. Adolescents express strong desire for friendship, like all adolescents I know, but they stress they want to be accepted as they are without being forced to socialize in a way that doesn't feel natural to them. They say, I don't want people to treat me differently. They made a group of friends for us. It helped me feel better socially, having people talk to, and we still keep in touch. Regarding the next theme, independence and daily functioning, we see that both psychiatrists and parents, they view structure guided skill development essential for fostering independence. They say The goal is to reduce distress and help them function with their capacity. We need to focus on improving executive functioning and emotional regulation to support daily independence. And the parents, they worry. We constantly think about how to prepare for the future. How much independence is truly possible? Adolescents, they also emphasize the importance of independence and daily functioning, but they want to achieve it in a way that fits them and not the social norms. They say, I don't want to be fixed. By the way, most of them didn't like the term ASD, autism spectrum disorder. They prefer to be called as, I'm autistic, you're not autistic. So I don't want to be fixed. I just want to be supported in a way that makes sense for me. I want to be independent, but sometimes it feels like people expect me to do things their own way, not mine. I used to feel like I could do things alone, but now I know I just do them differently. Self-understanding and acceptance. I'm going to start with adolescents. Adolescents strongly emphasize the self-acceptance, with many seeing the diagnosis as part of who they are, rather than something to be fixed, as I mentioned, a disorder. Some reject the need for a label, while others find it validating. One of them said, I don't need to be labeled to tell me who I am. Psychiatrists and parents, there's a big gap with self-understanding and acceptance as a goal of treatment compared to adolescents. There is a big gap in the purpose. While parents and psychiatrists focus on adaptation and skill for navigating in the world, adolescents, as you see it completely different. Psychiatrists see the treatment goal to balance between helping the individual recognize their identity while also teaching them skills for functioning in society. One psychiatrist said there is a fine line between adapting to society and losing yourself. We must ensure they remain true to themselves while learning necessary skills. Another one said, diagnoses help the adolescent not only to understand themselves, but also to communicate their needs to others. Masking. Obviously, masking phenomena, adaptation or suppression of natural autistic behavior in order to fit neurotypical expectations. So both psychiatrists and parents, they see the benefits and risk or downsides of masking, but they still see it as a social tool to navigate through social situations, sometimes overlooking the emotional tool it can take. Autistic individuals were most vocalized about the downsides of masking. They're saying, masking helped me look normal, but it doesn't make me feel normal. Sometimes I don't know who I really am anymore because I spent so much time to pretend I'm someone else. Strong quotes. Well, since I'm presenting only the treatment theme, so it's a bit shorter than I expected, but because I'm the only one between you and the coffee break, so I bet you're all happy about it and mask a little bit when you're staying here. I would just go back and I would say that one psychiatrist even told me masking is natural behavior. We all do it to some extent. Think about simple manners. Like I said now, all of you, I bet some of you really want to go out and drink coffee, but you stay here, you listen, you smile. Simple manners. We all mask in certain ways. But obviously for autistic individual, it's much more difficult. So I will conclude and say there is a big gap in the expectation from the treatment objectives and treatment goals between those three groups. Adolescents see something else, parents see something else, and psychiatrists see completely something else. This study is the first to compare autism and neurodiversity perception across autistic adolescents, their parents, and child psychiatrists, obviously incorporating autistic researchers inside. And masking is a key example of these gaps. While parents and psychiatrists see it as helpful social skill, adolescents describe it as exhausting and even identity disturbing. So where do we go from here? We're going to expand this study for greater diversity. We're going to add 6 participants from each group to increase demographic diversity. We're going to further explore the rest of the themes, asking adolescents, parents, and psychiatrists about autism, about ASD, treatments, challenges, neurodiversity, and life with autism. Thank you very much.